Oh, sure,
Just let me
but,
know.
it's tough to do right now, but she gives up.
We up and running?
It's more than-
Okay, we're going to call the meeting to order. It is Tuesday, February 1st, 2022. Please stand for the Pledge of Allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Morning, Uncle.
Minutes and reports received and filed.
We don't have any.
Commissioner Committee Liaison Reports, announcements, and upcoming meetings and events.
Well, just about everything's getting canceled for the rest of the week. Meeting with our JCREP executive Luke this afternoon, and then trying to catch up with meeting with Lincoln University as well. Looks like Communities has been postponed till next week, right?
Yep.
And then we're supposed to have a Cole County Extension annual dinner, and it's postponed.
Okay, good.
I don't know about East Side Business Association yet. Supposed to be a cornhole tournament down in St. Thomas. If anybody's interested, get with me. I got a flyer on it. Special Olympics, there's a trivia night Saturday as well. I think that's about it till next week. Just get your snow shovels ready. And it's good.
Tomorrow I have a meeting, a Heartland Port Authority meeting. And it's Lions Ham and Bean tomorrow.
And they haven't canceled.
Right. Jeff mentioned the two Thursday events that have been canceled, the Extension Dinner and Cole County Communities. On Monday of next week, there is a public hearing at City Hall on the 10-pin bowling project, which has
Yeah,
a
I've got that on my
tax
calendar too,
abatement
so,
issue in
yeah.
it. Okay, at 6 p.m. next Monday, I plan to attend.
Okay, well, right now, Ham and Bean is going on tomorrow. I'm supposed to go to MU and meet with Governor Parson, LU, MU, and Moberly Area Community College, but I got a feeling that's gonna be canceled. And I don't, we're gonna still do our medical Zoom? Okay, okay. So that's all
Snowed out.
I'm sorry?
Snowed out from the medical Zoom.
Well, okay, any commission comments? Bids and contracts, and the unfinished business. New business, accounts payable review.
We don't have accounts payable this week.
Okay. Signing of 2021 asset forfeiture equitable sharing agreement and certification.
This is an agreement we sign every year. Whenever Mustang grant went away, they put the money in our budget, and then Betsy would keep them separated in there, and this is just that equitable sharing agreement that we keep.
Yep.
Motion to approve and sign the 2021 asset forfeiture equitable sharing agreement and certification.
Second.
All in favor?
Aye.
Aye. Approval and signing of Cdve grant, is that supposed to be?
That's me.
Okay.
So,
Good morning.
Good morning.
The grant that we had applied for, we applied for several, but we returned, or got returned the grants for the sheriff's office. And this one is for $11,998. And it's a 100% grant.
Why didn't they just round it off to 12,000?
I don't know.
So it's just a grant, and there's no cost to us?
No cost to us,
Yep,
no.
like that.
And then I have the cover letter
that down or up from what we usually get? Do you know right offhand?
This is a brand-new grant. I've never applied for the Combating Domestic Violence Extremist grant, and so this is something that I don't know what it normally is. We
Very good.
caught it on its second round, and so in total through the state of Missouri on its second round was $120,000 roughly. We applied in 3 grants for $115,000 worth of that, and we received almost $12,000.
Okay, cool.
Good, thank you.
Thank you.
A motion to approve and sign the CDVE grant.
Second.
All in favor?
Aye.
Aye.
Thank you.
Okay, Sheriff to discuss staff salary issues. I got initially, this is one of those I got initial.
I got a few things for you. If we can just get to the bottom of this, we just saw I'll just go sit down. I don't think you're gonna do that. So anyway, so the salary adjustment for the new lieutenant position you gave me, we appreciate that, but then when we made the selection, the sergeants are already at the $56,000 that the, according to our grid, that's what the new lieutenant's supposed to go to. We're in the process of changing the grid completely. I'm going to be bringing that to you guys shortly, hopefully within a month. But what I would like to do for this lieutenant's position is do an increase of $3,000 for this new lieutenant's position. I do have the money in my salary line because right now I am 22 people down. So I have the money in my salary line to be able to make that. You want me to go through all these or you want me to just wait one at a time?
Let's keep going, I guess.
Yeah,
All right, then number 2, the incentive pay. We did this last year, and I did get 2 people with it, so I'd like to implement this again. Jailer would be $2,000, deputy would be $3,000. It's not much, but hopefully it may attract some to come our way. And again, this is revenue neutral because I do have it in my salary line as of right now. And then the last thing, number 3 there, was a reclassify current job position. So Eric Peters stole one of my people, and I hate him. And anyway, he's whenever this position was leaving, and we're looking at it, bidding it out, we started looking at what he actually does and what he was at. And he was actually at a civil processing specialist, which was only one person in that job description. And after we started looking at it, and I put a copy of the new job description, we saw that he does a lot more financial than what we determined. So we want to change him from a civil processing specialist to a civil financial assistant. This will be revenue neutral. It is an increase in starting pay. One is $28,000, the other one is $33,500. I'm already paying him more than $33,500, so it will be revenue neutral for us to advertise this. When we put it out, I can put it out at the higher amount. Again, I just wanted to say that I hate Eric for taking, so I just want to make that on the record, make sure everybody understands that. That's all I have. If you have any questions, be happy to listen to them.
When we talked about this, John, we were talking about your grid, and I know our grid's always changing. You said you're working on adjusting yours at this time anyway, correct?
Yes, so with us paying off the debt this year, while it's going to decrease our sales tax, it's going to increase my operational funds, so it does give me some wiggle room to be able to try to adjust some salaries. So I'm not there yet for you guys. I'm working on that right now. Hopefully I'll be able to come to you within a month and give you what I believe the new grid should be so we can talk about it.
Sheriff, when this year ends, so does our debt on the building?
Yes, sir. Yeah, our building will be paid for.
And the sales tax rate drops from 0.5% to 3/8%?
That's correct.
Okay.
Any other questions for me? Anyone?
Just this observation, I guess, the term revenue neutral sometimes is overused. It's revenue neutral this year. But if, we've talked to other elected officials at times that have a position open for part of a year.
Right.
And adjust salaries accordingly, and for that year it works out. But the next year it's more of a challenge because the people come in there at a higher number than they started the prior year with. So just an observation.
No, that's true, and I agree. And number two, the incentive pay, that's just gonna be for this year, so that one will go away. Hopefully, we'll be full staff by then. And then, the salary adjustment, we were gonna have to adjust that. That's one of the ones we would have to adjust anyway before the end of the year. So, and then the revenue neutral on the support services. So, and I know I hear people say that too, but in all actuality, these truly are revenue neutral for us. I don't have to ask for any additional funds from you. How about that?
You'll just ask for something
That
else.
better?
Forever?
Well, as far as you know, I'll say until tomorrow.
Okay.
I'm fine.
Go with it, yeah.
Oh, I forgot to mention
So
his name.
does this take action on our part or observation on our part?
I guess signing the pay forms will be what it is, right?
If you want to change that grid to the 59, and then if you,
I don't know if we're changing it until he does
So-
all the changes.
So what I'll do is, I'm not changing the grid, but I'm changing his salary. So I've got his salary sheet on my desk right now with the new salary on it. I will sign it and send it up to you for you guys to sign, and that approves that salary change.
Okay.
So, and
So-
then
how does that
Debbie?
affect the other lieutenant?
the other lieutenant, it doesn't affect him at all, because he's at an even higher amount.
Because we've done that before, when they make a move, if they're already at that rate, then we did bump them anyway, a certain amount.
I think he would get a $15 pay raise if we kept it at 56. So,
It was the old days with Archer, it was the 2,000 limit for the year, but you guys haven't used that in quite some time.
We kind of use it as a guideline, though. That's kind of what we did. If they're moving up and getting a promotion, but they don't get any promotion in pay and they're getting added duties, I mean, I don't think it's fair to do that to them. So we did do it. And I forgot it was at the 2,000 then, so that's kind of where I was at with this, that he's going to be doing additional stuff. And I guess we did kind of talk about that too.
Yeah.
That was last week or whatever,
Mhm.
so.
he's going to be doing a lot more additional stuff.
Okay. So,
Yeah, I'm
it's just the
fine.
pay sheets and I'm okay with it.
Thank you.
Okay,
And since you're not asking for anything else ever,
Can you,
Till tomorrow.
can you vote on the 2,000 and the 3,000, because that was voted on last year to do that incentive pay.
the
so-
incentive,
yeah,
So if you would continue that of some sort, a vote to continue that.
all right. I'll make a motion to approve the 2022 incentive pay for new employees, jailer $2,000, deputy $3,000
for 1 year or?
for this year,
For this year.
2022.
Yeah.
No, I'm good if you want to say a year. I'm also good if you want to say 6 months. And then we can relook at it again if you want to do it that way. How about we do till, if it makes you feel better, we can say till July, if that would be easier for y'all. I would rather do the whole year, that way I don't have to, and I can always stop it if I want to, but.
Do the, just
I
do
was
the whole
fine through the whole year.
Yeah, do
We're
the
gonna
whole
do it.
year.
Good deal, thank you.
Just have it, you don't have to come back up there and do it again.
Yeah.
Second.
All in favor?
Aye.
Discussion of job description reclassification, Sheriff's Department, is that,
That was the.
that was that one,
Yes, sir.
okay. Good, okay. Inventory management software for EMS.
Hey, Eric, it's great to see your smiling face. There's 3 EMS people here and no masks on. Is there something going on that we don't know about?
Not necessarily. We're just socially distanced here. So
Okay.
I will just give an anecdotal update that
Don't even go there.
the county does seem to be in a downward trend. We are seeing less calls for service. There seems to be less of a
Sorry, I thought you were going somewhere else. Go Bengals.
fair enough.
Downward trend, is that what we heard?
So yes, we are on a downward trend. Things are looking better at this point. So
I was
it'll be
just
interesting to
teasing.
see where it goes.
He's a St. Louis Rams fan, so I was kind of going there.
I know. I thought.
Oh, I
thought that's where
mean
we're going.
LA. Yeah, shoot. Okay. All right, I digress.
All right. Well, good morning. Myself, Chief Campeter, our new logistics chief, Chief Gibson, are here to discuss an inventory and asset management software with you. We currently have a system that allows us to track and trend what is on the ambulances. It's basically a checkoff sheet, but it doesn't necessarily track what comes in, the lifespan of that medical equipment, where it goes. Those all lead to difficulties with ordering, with expirations, with products getting misplaced in translation. So we are looking for a way to kind of rein that in. And if you look at our medical supply budget over the last 5 years, we've had a steady 20% increase over that 5 years, resulting in a doubling in total amount. So we're looking at ways to try and curb that back. And one of the ways that we feel that we can do that is through better ordering, inventory tracking, and of course asset management. So we've met with several vendors to kind of evaluate their system. Chief Gibson has some personal experience with Operative IQ, so I'll have him come up in just a minute and kind of give his version. But as you can see from the packet that we've provided you, there's a couple case studies in there, and there's also some customer testimonials. On this top customer testimonial page, I'll draw you to that first line there. Our current medical supply budget for this year is $260,000. Once this organization implemented Operative IQ, they saw a $60,000 decrease in their medical supply budget in just the first year. So this, I believe, will be very good for us. I don't necessarily know all the ins and outs of how the inventory management and tracking works, and I will invite Chief Gibson up here to kind of tell you how this affects his life.
You should stand the whole time.
So the way Operative IQ works, when supply comes in, it gets put into the system with an expiration date, lot, all that. Then after it's taken out of supply, it's transferred to a cabinet, to a truck. With a click of a button, I can see every single expiration in the whole agency. Right now, our expiration process on the first of the month is pretty strenuous on the crews. This would allow that process to be refined with a click of a button. Right now, we're expiring probably $500 on average a month. I think that number would dramatically decrease with this system. Another aspect of it that Chief didn't mention is it has a fleet maintenance side to it that is also in the quote. So that would allow whoever has our fleet contract to see the back end, what needs to be done, and put all that stuff together. So it would streamline fleet maintenance as well.
So currently, right now, in order to order and maintain our medical supply, there's a central storeroom, and basically it's like your grocery store. You go in and there's 5 of a certain item one week. They come back in, they inventory it the next week. If there's only 4, then they order 1 box of it. That obviously requires man time and requires staff to do that. With this new system, all of that's done instantaneously. So when a crew grabs something off the shelf, it gets moved from the shelf onto the truck. Once it's used on the patient, we know that supply has been used. We know the exact amount, and we can now then reorder to restock that exact amount. There's no guesswork involved in it. It also will dramatically decrease the man time. So what we're asking for, the annual service license for both the asset and inventory management and the fleet management is $9,120 per year. There's initial setup fee of training and quick start. That's $2,300. So the initial ask is $11,420. we would ask that we just take this out of our current medical supply budget item. We are tracking well under what we had budgeted, and I believe that this would dramatically reduce those expenditures even further, so we could absorb that. I've discussed this briefly with Kristen. She seems to be in support. The other piece that this would really make life easier is for our hard equipment items, our ballistic vests, our turnout gear. All of that will be tracked in the system. So when Kristen comes to do, or the auditor's office comes to do an inventory, we basically hand them the sheet, and on the sheet it says exactly where all of our items are assigned to and who they belong to. So it would really dramatically reduce that process as well.
As Mr. Ridenour been consulted, does the software, I'm sorry, I guess our hardware accept this software?
Yeah, so this is a web-based program. It will not require any server space or anything like that, so.
Okay. Right.
It's along the same lines of what we use now, just a better, more refined system.
Is all this stuff, this might be getting to the weeds, but is it all barcoded that when you run through in and out of the place, you barcode this?
So this system does have that capability with the scanners, same sort of technology that you would use at the grocery store. Certainly a route that we can go. Once we kind of get the system built and the foundation in place, we will probably look at doing that. And that's, a relatively minor expense.
And sort of the proof that it's working is this expired product that you have to destroy, I guess. Instead of $500 a month, it will trickle down to, in a perfect world, to zero.
Yeah. It would trickle down. It would also allow us to be much more specific in our ordering, and have a huge reduction in man hours to kind of manage that process. Instead of utilizing, Chief Gibson plus 2 other staff members to do that weekly count and ordering, he'd be able to do it in, a couple hours on his own.
The system would essentially keep inventory on its own. I wouldn't have to have people come in and count my supply room for my order. The system does it automatically.
Yeah, it seems much more efficient.
So what do we have now? What was the system we had now?
Right now we have PS tracks.
Okay. What were we charged for that per month or year? Do you remember?
I have not seen that contract.
Okay.
I know we're up in August.
Because I thought we had something. I was just curious. And I'm fine with it. If you have a tool that does a better job, then
So with Opera
let's
IQ,
look at it.
we're looking at probably a 3 to 4 month build on it because it's so extensive, from trucks to supply rooms to fleet side. It all has to be built from the ground up. So we're looking at a 3 to 4 month build on my end. So I think it's a perfect time to deploy it, so that way when PS Tracks is up, we have that system in place and we can roll it live.
The limitations that we find with PS Tracks is it's very cumbersome for the frontline staff to use. It takes them a very long time to get through the technology and count where things are. It's also not really robust in the warehousing piece, the inventory piece. So really what we're using it for now is a checklist. Just because it is very cumbersome for use.
I know you have sort of a mutual aid and backup and that kind of thing with other ambulance districts or entities. Do you also have backup with one another with respect to medical supplies? Do they ever call you and say, hey, we just ran out of X. Do you have any X?
Not with other ambulance agencies, but if you will recall our MOU with the Jefferson City Fire Department, we do supply them with reusable medical supplies that they use on our calls, because we are the billing agency for that patient contact. So we do supply the overwhelming amount of the medical supplies used by Jefferson City Fire Department. This system would also probably integrate them into that, where instead of them sending over an email request of, hey, I need 2 boxes of gloves today, it would all be done through this system, and it would also allow us to track and trend usage and really understand where those supplies are being used and that sort of thing. One of the things that we can really build with the fire department is building a, each station has, 2 boxes of gloves on their shelf. Right now, it's kind of we're not really tracking the amount that they are requesting for their use, so this would really give us some oversight on that.
I only see positives here.
So, 2 options. I have a contract here if you guys are willing to put a motion on that. Otherwise, we can table this and continue discussion.
Does it take any kind of bidding process? Is it under the numbers for that?
It
or-
is under the bid.
Okay.
Bid numbers.
I'm good.
What's the bid numbers, 10,000?
It was 12,000.
12 now, okay. Well, that's,
But after that, it'll be just
Convenient.
9,120 a year.
yeah, I'm good with it. I mean, it's gonna save time and more efficient than the system we have. And I mean, the other system we got trying to keep track of everything and make sure something wasn't going out to where it wasn't supposed to be going out, so.
If there's a way you can track the positives on this, in other words, the expired is now from 500 to whatever, and also the time, I think it then will reinforce that we did the right thing.
Absolutely. We can, the time might be a little bit more difficult, but we
Right.
will start keeping an eye on that when we go live. The nice thing about this system is we can basically run any and whatever report we want to with a click of some buttons, so.
Okay. I'll make a motion that we purchase the inventory management software for EMS, first year cost of $11,420.
Second.
All in favor?
Aye.
Aye.
Thank you very much.
Thank you.
Thank you.
Discussion and signing of internet bandwidth upgrades for Public Works, Health, and the county campus.
Good morning.
Good morning.
So the reason why I'm here this morning is because I'd emailed everyone a internet bandwidth utilization report for our current system, and you'll notice that we're hitting our max bandwidth multiple times throughout the months. So whenever that happens, internet slowdown or stoppage occurs, and it happens to be mostly on the accounts that are tied directly to the annex. So I sent you an email, kind of gave you a breakdown of who's connected with what, stuff like that. So anyway, so the reason why I'm here today, partially, is to request that our internet service be enhanced out of the health department. Right now, they're running on a 30 megabit connection, which is, I think, going slow at times to stoppage. And so what I'm proposing is that I put in a 100 megabit connection out there through CenturyLink, who's our current provider. So, and then I spoke with Eric Landwehr this morning, and he's sorry he couldn't be here, but he had a meeting, and then they're getting ready for the snow, right? So anyway, but he totally agreed that they are in the need of the same type of thing out there. So as the county's internet requirements, usage requirements expand through hosted products and things like that, then we have to make adjustments. And so this is that adjustment. So for what I'm asking for, and Jill has looked at these documents, is what I'm asking for is that the internet connection out at the health department be added to a 100 megabit connection. The connection out at the Public Works Department, that it's upgraded to a 100 megabit connection. And then the connection for the Cole County campus, which is the annex and everything else, that it be increased to a 100 megabit connection. And then also, I have services and hardware that's going to have to be added to each one of those locations. to accomplish that, and that's through Huber and Associates. Also, this would allow us a backup connection at each one of those locations. So should their primary internet connection go down, then the backup would be back over to the county. So what we're trying to do is create a redundancy there where if one connection is out, there's not a complete outage. We have this current configuration set up out at EMS, and I think it's working pretty well. And then we also have this current configuration over at the Sheriff's Department. So with that, I'd welcome any questions or concerns.
So the backup you handle? I mean,
Right.
Okay.
Yeah, so literally, our department handles all of those things. But when we go through and we install the additional connection, there'll be basically it's programmed in there where if the main connection goes down, it kicks over to the county.
Okay.
So,
Yeah, I know, like Cap Region, they had backup with Huber and they had backup with Tiger Institute, but
so the only thing this doesn't allow, and I haven't gotten a quote for yet, is so it does increase or double the bandwidth for the county itself, but it does not provide a backup connection. So I will be coming to you later on once I get a quote for that, because we had an internet outage the other day through cut fiber, and the collector specifically asked me to get this taken care of. So while I was out on COVID.
he didn't buy ham and bean tickets, I don't know.
Just laying around.
Okay, so anyway,
We didn't have anything.
so
Brian, was the cut on I-70?
that's what I heard. Yeah.
So a cut cable on I-70 cut off our internet connection
did.
here?
Yeah. So that's why it's kind of a good idea to have like different technologies involved. So for instance, the Fiber Plus over at the Sheriff's office. Did you have an outage over there, Sheriff?
No,
So
we were fine.
they have a different, like they have this main connection's different than what we have.
good stuff.
But it got like Tolson's, because I was trying to get a prescription, and it affected,
Yeah.
not just the county,
Well, I
but
think
it
it took out
affected.
the phones too, right? Locally, some of the phones locally. So, but anyway, I talked to Christy about it, and I just think it's probably time that we do this, and this will buy us some time over the next years. So,
What's the cost involved?
so $200 a month with a $100 one-time fee. So from this point on, there'll be an additional $200 a month added to our bill for the health department, and then also for public works, and then the price tag on the county, since it's so the county is kind of like the main line for everything. So the county actually goes to $11.95 a month, and I think it's about half of that right now. Is that right? Yeah.
No, we need backup. It's,
Yeah.
no, that's,
We need to speed it down, start with, all the users on the electronic health record, it's slow, and then we're using, Microsoft 365 for our quarantine list for our Excel spreadsheet. The other day, they had to use, a hotspot to be able to run that spreadsheet.
no, we need this.
And then the cost of the service, one-time cost for the services, that includes 3 routers and access points and things like that, is an installation and configuration is $8,296.92. So I would ask that these things be approved so I can get those in the works, because it does take time to get all those things kind of lined up.
So what was the attachment on the agenda, the Meraki Fiber Plus connection? I can't
That's the
remember
Huber
name.
Services. That's the $8,296.82.
Okay.
Or
Didn't
92
open
cents.
that one, so. And then I noticed on the other ones that there are 24-month terms on the Cole County campus, and then 36-month terms on the other ones, so.
Right.
How do
So
we do those? We do those like 1 year at a time and then renew them, or?
how we normally do it is CenturyLink knows that those are all subject to, these are the same kind of contracts we've done over the past several years. And so CenturyLink knows that these are subject to the funds being available. So we typically do go ahead and sign those and go from there. So
Okay. Just didn't know if that was in writing somewhere.
Yeah, I've had that in writing before, and I could probably pull that document out, but,
This one becomes very complicated when we do bid out the phone system, because like you say, all of these different functions happen at different
I
times.
just-
They have to be purpose.
yeah. Well,
Yeah.
of course, that whole bidding out the communications and stuff, that's a whole nother conversation we would need to have sometime, so.
So then in 2 years, we'll look at the Cole County campus one, and then the terms may change at that point, but this locks us in at this rate.
Right.
Subject to appropriations being available.
Right, I'm not gonna get on my soapbox, because Jill said that I don't bring up stuff that's not a problem right now. But, so the bottom line is you do not want to, so this isn't like necessarily like just a commodity off the shelf where you pull an internet connection off, hey, it's less expensive, so we'll go with it that direction. It's way more complicated than that. So I would say that when we're talking about the bid process and all these things like that, I understand that there's statutes we have to follow and everything else like that, but also you have to look at maintaining the integrity of what we have going on here at the same time and not, does that make sense? Like, you don't want to change everything and then all of a sudden break a lot of things in the process for the sake of saving some.
I'm not even changing my cell phone service.
Right.
So I'm,
Same principle.
I'm good with,
But yeah,
we're good to go.
Yeah,
but yeah, I was,
Yeah, so I see what you're saying. It's just,
Yeah.
so,
yeah.
that's all I was curious about. Make sure it was understood, I guess. So.
Yeah, well, I'm gonna ask that these be signed, or at least be voted on, so I can go ahead and proceed with getting these things done, and then I'm gonna ask you for more.
Why don't you just have a seat by the sheriff?
Right.
Take the number, have a seat.
I actually learned this from the sheriff. So.
Got a deal for us.
okay.
All right. Yeah, I'm good with it. Let's
Yeah.
run with it.
I'm fine. You want to make the motion, Jeff?
Do we need to?
Is that what we need? The ask is something that's going to cost $2,500 a year for public works, $2,500 a year for health, and then the campus is a,
It's a bigger ask. It's
Yes.
11 something.
$11.95 a month, the other one's $199, and then there was some other initial cost in there. I think I
Yeah.
just closed all that out already, but it was a,
but the $11.99 is replacing a 5-something. Is
That's
that
right.
It's
Yeah.
it's half of the $11.90
So-
increase.
That's
Well,
right.
But, okay.
I'll make a motion, we sign the internet bandwidth upgrades for Public Works, Health, and the county campus as presented today.
Second.
All in favor?
Aye.
Aye.
Okay, then,
You're done.
Hardware.
yeah, okay, yeah, get the hardware.
Okay, so we need another one for that? Okay, I was hoping that was part of it. Okay, make a motion to approve the purchase of the hardware for the internet bandwidth upgrades.
Second.
All in favor?
Aye.
Aye.
So there's just a couple of things that I want to kind of bring to your attention. Well, when I don't talk for a long time, I have a lot to say now. So we're out of hotspots now. So like the hotspots that we originally had procured due to like the pandemic and people working from home, those have all now been distributed. So, and that's for like the ones I have from the county. So I have no more hotspots available for people who need to work from home for whatever reason or things like that. Those cost, those cost $38 each a month. And I just kind of bring your attention because I really feel like we should order 2 more and have those ready to be issued if needed. So what's happening is I'm issuing these. So right now, EMS has one, and then we have an employee who has one. I actually have 2 employees that have each one because they've been out for a protracted period of time.
Okay.
How many do we have right now?
3 total for the county.
So you want to have
I was
5?
thinking we had more than that for some reason.
That's just under his, building maintenance has,
Well, they use iPads.
yeah, but it takes.
I'd like to get one
Yeah.
for the collector's office, because in this case, where we lost internet service, we couldn't take payment, credit card payments. And we had people come in they wanted to pay by credit card, and we had to tell them, you can't pay today because our internet service is in.
Let's talk about that offline, because there's gonna take a little different kind of engineering to make that happen.
Sure.
Yeah. Let's talk about that. Yeah.
All right, so you'll talk to Bishop Brian when we're done. So we're needing 2 for,
2 for the county,
So it'll be total of 5.
right, for the
Yeah.
county, that's right.
I guess I'm confused because I had a lot of people raising their hands saying they had one. You're saying we only have 3?
Yes, sir?
There are some in
Well-
other departments
Yeah,
that they
we pay
purchase.
for it out of FAF funds, it's not paid for by IT.
Right. I'm only talking about the ones that I issue, yeah.
There's we, and then there's we like this.
The commission.
The small we here is the commission. The
Commission,
big we
hotspots.
here is the county.
Right.
And
Yeah, there's more than the 3 hotspots for the entire county. So whenever we get done talking about this, then I'll tell you about 2 more.
I was trying not to cuss today. So are we needing a 2 right now?
So right now, we don't need them, no. Like I don't have a place to go with them, but you don't know that until like you're asked. So like for instance, I don't, like if somebody says, hey, I need a hotspot to work remotely, I have nothing for that.
How long does it take between the time you order a hotspot and you get it?
2 weeks.
I see.
Yeah.
That's the problem. That's why you need it on hand.
So if Debbie stays home because
Right.
of the ice, snow and ice, then,
You can just name it. I mean, this is just a different time, with these remote workers and things like that, so.
Do you need 2 spares or 1 spare?
I can get by with 1 spare until,
I'd authorize the 2, but buy them 1 at a time. Or I actually authorize an additional 1 when needed, and always have at least one in inventory.
Yep.
It's not a big deal. It's not going to break us, but $38 a month, if you don't need to spend it, don't. But
Keeps adding up. It's
It does, it
but
does.
we got our cell phones that we pay people for, and you can't use it for a hotspot. I've used my phone before for hotspots, so. That's what I'm struggling with, some of that there.
yeah, right now, the hotspots are being used in areas that there's no service.
yeah.
I thought hotspots needed cell service to operate,
Depends on
so
your
now
carrier.
you're telling me that
Depends on
they
your
can
carrier.
operate?
Yeah, it depends on your carrier. So like evidently these AT&T hotspots are working in areas that some of them won't, so.
And if I may, Jeff, I agree with you 100%, with the exception of when I transfer my phone and have it go to my cell phone, and it's being used as a hotspot, I'm gonna miss calls because it's already taken up the bandwidth being used as a hotspot instead of being used as a phone.
What he said.
Well, that's not a bad thing to miss calls sometimes.
Not when you're emergency management director. No,
But I'm sure he's not got that problem. He's gonna have
I
an
haven't.
iPad and a phone, each on their own. So he's not running into it, but I'm talking about if somebody's working from home and we're just, I don't know, it's just,
Jeff, I think there's quite a few people that are using them that do not get a cell phone allowance or anything from the county.
how many more people we got working at home right now?
Plus it eats up your minutes on your cell phone.
I thought everything was unlimited nowadays.
I think that's probably a whole nother discussion as far as the cell phone usage and those kinds of things like that. And it's probably needs to be in a closed session due to security.
Yeah, I was gonna say, doing it on cell phone, that can be sunshined. That's not a good, that's not a good option.
I know what Debbie wants me to say. She wants me to say we need to buy 100 cell phones.
I did not say
I am fine with getting 2 more. That's,
And the $1,200 phones.
Hey, girl.
I'll offer a motion to okay Brian's request for 2 hotspots.
I will second. All in favor?
Aye.
Aye. Opposed?
Nay.
All right, and then the last.
Not that I'm totally.
The last?
The last thing,
Damn.
the last thing I have to say is that the nice part about this is already budgeted. So Public Works did contact me, and they needed 2 hotspots for out there too. So. and
For
this is
where?
Budget, Public Works. So.
For where? In the dump truck?
You
Got your phone. I do everything on it, so I don't need a hotspot. I just,
Yeah.
no.
Eric Landwehr.
Go ahead and vote on it if you want to go for it.
Eric
This
Landwehr.
is getting ridiculous.
Yeah.
It's spending.
Yeah. Should I shouldn't do this all at one time. You guys didn't tell me that. Okay,
You're
so-
just trying to wear me down.
But anyway, they had requested two hotspots out there, and it was budgeted for this budget year. It had been approved. And as far as the particulars of how they're going to use them, I know they had employees out with COVID and stuff like that recently. So they were trying to do some work from home and things like that. So these are literally being used for work purposes.
I'll make a
I can do it
motion.
all on the phone.
I'll make a motion to authorize the 2 budgeted hotspots for Public Works be purchased.
I will second. All in favor?
Aye.
Aye. Opposed?
I am sorry to take up.
Are you done now?
Yes. Thank you so much.
Eric and I both never want to go after Brian again.
Hey, you got Mahomes into it 13 seconds, buddy. From now on.
Okay. Do we have anything else before we go into closed session?
I have something real quick.
What?
What?
After he wore us down, okay.
Yeah, so that's what I'm gonna bring up. So, normally policy in our office is if someone doesn't feel safe to drive to work in hazardous weather, I give them the option to work from home. With the incentive pay or the premium pay, they now get excluded from premium pay if they work from home during the period. Yes,
So exposure is not.
yes.
Well,
I just want clarification.
Is it 1 hour at home destroys it for the 2-week period, premium pay, or is it there?
I don't think,
Of 8.
But if we call it off or close the office or do the inclement weather thing, it's our action. That's causing it. So
yeah,
is
I
that-
just want clarification so I can tell my people today, like, if they decide in the morning that they don't feel safe to drive and they want the option to work from home, I want to inform them ahead of time whether that disqualifies them for the premium or incentive.
I think with what Nick is forecasting to us, which, that it's probably gonna be Wednesday and probably into Thursday as well. So I would think just essential people and everybody else, I'd stay.
Well, unless something stupid happens, we're supposed to have 8 to 12 inches of snow by this time tomorrow.
Yeah,
And I don't think it's a bad idea to plan on either implementing the inclement weather policy, which means if you can't make it, don't kill yourself trying to come in.
And I don't
But-
want people to feel like they
So-
have to come.
But, okay, but what's different now is inclement weather before never had a premium pay factor.
Correct.
It does now, and I think we need to relax the premium pay rules with
Correct.
respect to, if we're saying it's inclement weather while you're not here, as opposed to it was a nice day and you decided to play golf that afternoon, that's different. So,
Well, I don't want them coming in to kill themselves for,
I agree.
just to make sure they get the premium pay.
No.
Right.
That just
So we should-
eliminates the reason for the inclement policy.
We are, from an EMS standpoint, already looking and planning an emergency operations plan. So I would encourage you, for the benefit of not only the employees, but to relieve some potential stress off of our system, that we implement an inclement weather plan and do not require people to come to work tomorrow or Thursday.
Well, there's 2 different policies. The inclement weather is really not, don't come in all day. It's either you could be late or leave early. It doesn't say that. Then you get into, you can have emergency clothing.
Closure.
Closure of buildings.
Yeah, it's
So there's 2
totally
different
different.
policies that we currently already have. And we have to be careful to either use one of these if it comes to federally potential money, if this is declared an emergency.
Inclement weather, they have to use time, right? If they don't come
Or
in.
they can make it up. There's 3
Or
options
make it up.
there.
But if we close, it's like a holiday.
It's basically.
You're closed.
For every hour that essential people work, they get to accumulate more sick time. But the ones that are not here, we give the sick time and we take it away, kind of thing. So, yes, we pay them for the day. that we also benefit the people that do come in that have to be here from the sheriff.
I'm not worried about pay and sick leave. This is going to significantly impact our ability to deliver services. So the less people that are out, the better. So whatever we need to do to make that happen, I would encourage you to please do so.
We've had huge forecasts and didn't get squat, so I'm not gonna close down tomorrow and Thursday at this point, but I agree with what you're saying. We've also had forecasts for what, 4 inches, and we got 2 foot of it, so, I mean, it's definitely on the table with the closure. And I agree, cause we got the guys trying to get the roads cleared, and it's harder whenever they have cars stuck in the ditch in their way and getting in their way and meeting them head on.
Yeah, I think barring something really unusual, we're not gonna be here tomorrow. And if we would say we're not gonna be here and it doesn't happen, then we tar and feather Nick. I mean, you know, it's, you do that to him once, he won't do that again.
Work said on the radio this morning, advised everybody to stay home tomorrow and Thursday.
Yeah, I think the report now is it's going into Wednesday night and into Thursday, so.
I personally would think that you would want to shut down at least tomorrow, and I agree, maybe not Thursday yet, but
Yeah.
tomorrow, I mean, we're gonna get 7 inches of snow. I mean, that's, at a minimum, we're gonna get 7 inches of snow, and the roads are gonna be bad.
Yeah,
Current predictions are that it will continue to snow through Thursday morning, but be dry Thursday afternoon.
Right.
And that could change by 5 p.m.
But, and that's, you know, and that's Public Works and MoDOT working on the road, so they may be good enough to come in on Thursday, I don't know, but tomorrow, I'm like Eric, I
yeah,
think the sooner you get ahead of this, the better off you are.
yeah. And I think, you know, if it doesn't happen, we tar and feather you and Zach Paul. We just, you know, we can,
Well, I'm in good company.
yeah.
Call me at 4 a.m. and I'll tell you, because at that point, we'll know a lot more.
And you ought to, and also, while I'm on the soapbox, you ought to rethink that policy too on the sick leave. That's horrible. I don't agree with that at all. You need to do something, because you're paying somebody full day salary to stay home, and the other people, you're giving them a sick hour that they may or not be able to take. I don't think it's fair. But
We
that's
can
the worst
revisit
of
that.
reality.
Yeah.
I'm not opposed to revisiting that.
Yes, sir.
So, I mean, if y'all want to close down for tomorrow, right now, make that decision, or if we can say at 4:30, we make a decision, I'm just not
It
ready to
doesn't.
right now.
So the next weather brief is at 1500, correct? From the National Weather Service.
Cool.
Yeah, so make it then, and then that way we can tell our people.
I want y'all to be like kids at 6 o'clock in the morning, you're getting up watching TV to see if school's closed.
Now we get texts, they don't even have to do that anymore.
No,
Our school is-
I'd like to do it as soon as we know, but we've seen weirder things happen, so I'm not, we had, I don't know, what was it, a year or two ago, we had a forecast for craziness. Nothing ever came of it. And so,
I'd
and I
rather
think the
make-
city actually,
Personally, I'd rather make the decision based on safety rather than on woulda, coulda, shoulda, though, Jeff. understand
but I can do
your-
that at 4 a.m. also.
Yeah, but you're gonna get people who are gonna be trying to find places for their kids, because there's no school tomorrow. So you're gonna have to.
They're gonna be doing that regardless.
Okay.
And then they get up and know, okay, I don't have to worry about finding
I'd say
any
maybe
place.
after the next briefing, we make that
Maybe that's good,
decision.
and then
And-
you can blame Nick if.
Well, and you, since you're in favor, we'll tar and feather you too. Yeah, we could have it, make it for United
Don't have
Way,
to take
and
a
we
number
can
and
tar
get
and
along with
feather.
Everybody else, but yeah.
Or either that or some wooden stocks out front, and we just.
All right,
put
so
you
we'll
up
wait
there.
till after the 1500.
Yeah.
Yeah, make
briefing,
the decision
and
then,
We can,
yeah.
And for non-military people, that would be 3 p.m.?
Yes, I'm sorry, yeah.
Which would be, I think would give our employees time.
I was in the
enough to-
Army, I know. Tell time, okay.
So no matter what we do, we're not holding anything of this against the premium pay?
No, no.
Right.
I wouldn't.
No, it's
Did
not.
you know Brian was a medic in the Army? So, Eric, if you ever need,
You just got volunteered.
Eric, I like the snow. You need somebody to drive one of your medics around, let me know.
So, at one, we'll be in recess until 4:30 today, and at 3, we'll make a decision
Yeah.
about
I'd say
whether we're
sometime
closed
before
tomorrow.
4:30.
Well, prior to 4:30,
See, I
we'll
might
make
be
a
in
decision.
Columbia
4:30.
still, but you can.
Well, there's two of us here that can get it done.
Okay,
Just kidding.
yeah. Yeah, you can check.
Okay,
Yeah.
all right. Oh, boy.
Everybody can be off tomorrow but Jill. Yeah, but I changed that. Jill's gonna pick you up in his Jeep.
We'll send the car.
That's probably more dangerous than driving in the snow.
Drive one of my deputies.
Yeah, there you go.
Side rails get slick this type of weather, so be careful.
Okay, anything else before we go into closed session?
Motion to go into closed session pursuant to section 610.021 of the revised statutes of Missouri. The commission will go into closed session to discuss the following: personnel issues.
Sheriff?
I'm sorry, I thought you were done.
Personnel issues under section 610.021, subsection 13. Existing or proposed security systems under section 610.021, subsection 19.
Second.
Roll call?
Sam,
Yes.
Harry,
Yes.
Jeff.
Yes.
Okay.
Jessica kept asking me questions.
I just text Scott, told him that we're ready anytime.
Yeah.
They can come over. We also have something else on there too, so. But if we'll do Judge when he gets over here, get his knocked out. So Sam, when are you going up there?